Hello, my name is Sukti Benz and I'm one of the nurse practitioner students of UMass Global. So today we're gonna be discuss about the psychotherapy sessions with one of the patient. So I just choose the one of my patient who is a 46-year-old male. So patient came to clinic 15 days ago for disturbed sleep and does not want to talk to anybody, no pleasure, and do not want to social. Patient has a one son. Patient lives with the mother and son. Patient has a family history of depression. His father had a depression and he died with a severe depression. Patient has his symptoms arise 2 months ago when his wife left him. She cheated on him as per patient told. Patient's not able to adjust it in that kind of situation. Patient's mother bring him to the clinic for treatment. Patient also fight with his mother and he just want to stay alone, doesn't want to talk to anybody. Patient is not taking any kind of medications this time. Patient started psychotherapy to get better. I selected the following therapies to be help the patients to get better. So first of all is the it's called the interpersonal psychotherapy. So interpersonal psychotherapy is focused on the relieving symptoms by improving an interpersonal functioning. It addresses the current problem and relationship rather than the childhood or development issues. The second one I selected are cognitive behavior therapy. So cognitive behavior therapy is focused on connection between thoughts, feelings, and behavior. It helps the individuals to identify and change negative or unhelpful thinking pattern and behaviors to improve emotional regulations and coping skills. So the third and the last one I choose for this patient is the Gestalt therapy. So Gestalt therapy is focused on the personal responsibilities and the present moment. It's encourage self-awareness and integrations of the thoughts, feelings, and actions. So these are the three psychotherapies which I just choose for these patients to get better and improve his health. So let's talk with the patients regarding then. Okay. Hello, Mr. Bill. How are you doing?
I'm good.
Okay.
I'm doing better.
Good. That's okay. So I know you came last, I think 15 days ago, right?
Mm-hmm.
Yeah. So do you feel a little bit better? You know, we just talked right last time. How are you
Yeah,
feeling?
I feel better. We talk about when you talk about me and what happened to me. Yeah, so I feel a little bit comfortable, feel better.
Okay.
Yeah,
And how was your sleep? I know you told me like, your sleep is disturbed.
yeah. Then now I sleep. I'm able to sleep now. Before I'm disturbed, but I
Mm.
talk with you. What happened to me? So now I feel better.
Okay. And how many hours you sleep?
Like 6 hours.
So you think you sleep 6 hours?
I think so. I haven't checked the
Mm-hmm.
time, but yeah.
Mm-hmm. So okay, got it. And how was I know it's too early to ask, but how you feel your social life? Kind of, you little bit like to sit down with your
Yeah.
family, friends, like that.
Yeah, now I sleep with my sleep like very good, and
Mm-hmm.
I talk to my son and talk to my mom.
Mm-hmm.
Then yeah, a little bit better now. So
Mm-hmm.
I spend time with them, so I feel better.
Okay, that sounds good. Yeah, yeah. I know you talk about your situation last couple weeks ago with me.
Mm.
So, do you want a little bit talk about that? I know just a little bit like what happened that time. Like I know 2 months ago there was something happened which makes you in that kind of situation. So, what happened on that time?
Yeah, I find out she cheated on me. That's why we have an issue, and then she left. So that's why I'm more disturbed.
Mm-hmm. So what about your son? So he still lives with you?
Yeah, live with me. Yeah.
Okay, that sounds good. So, your son lives with you at least, right? So, let's, we gonna be just do like little play. So, we gonna be just like imagine your wife is over here, and I know if you have some feelings, and so this helps us to, kind of understand the situation, and like whatever your frustration, at least you can just take it out that one, so you can be, kind of see where we have the blocks where we can treat them. Okay,
Okay.
you feel okay with that?
Not really, but I can try.
No? Yeah, yeah. Whenever you don't feel comfortable, you can please let me know. So we can, we can just stop. This is just a part of this therapy, so we can kind of, more relate to the reality actually. Okay, so you can think about that, like your wife is in front of you. So what will be your reaction?
It's hard, I know, but
Just think about, that, this chair is kind of your wife. I don't know. Her name is Maria.
hmm
Okay, so think Maria is in front of you. So what right now? What is your kind of, you know?
yeah, why you did to me? What's wrong with me? Because I love you so much, but you still cheat me. I don't know what to say, but I don't want to talk about it, honestly.
Okay, okay, no
Yeah, I'm
worries.
really
Yeah.
disturbed because I don't know how to react.
Mm-hmm.
Sorry, yeah.
No, it's okay. It's okay. If you don't feel comfortable, that's fine too. No,
Yeah,
no,
it's
we.
like I don't want to think about nothing yet. It's already I don't feel good. Then I'm thinking about what she did to me. Because I'm honest with her, honestly, and then I find out she cheat on me. Then I really disturbed. So I don't want to think about that.
So, yeah, okay. So as we discuss, like, we just like little bit play. Your wife is here. So, but right now, like, what is your feelings? I'm just like, because I my purpose is not like, to be kind of connection or something, showing to you, your wife and something bad. So just wanna be, because it's already passed. It's done. It's already done. You already understand these things,
Mm-hmm.
because this is not gonna come back. Because if probably it's already passed. So what is your feelings this time? What you feeling? I mean, because the thing is that if you don't know what are you feeling, what are you wanted, and then it's hard to be getting better. You know what I'm saying?
Mm-hmm.
So first of all, we have understand what do you want this time, like what is your feeling.
Yeah, then I'm thinking about her. Then I got a little disturbed. Because we spent a lot of years. We have a son together, and what happened to that relation? I don't understand why. So, so I'm just disturbed.
So
So,
you just disturb. Okay.
but yeah, but right now I'm thinking. Then you are talking. Then you guys talk to me, like now I'm start thinking this like I have to be step forward. So
Mm-hmm.
I have to think about my son. I have to take care of my mom. So that's not gonna help me. Then I have to move on. But
Yeah,
I'm
yeah,
trying. I'm
that's good.
trying
Mm-hmm.
to more try to more spend time with my son. Try to forget what happened, but it's a little hard. But I'm trying my best.
Yeah, because the past, I know there were some situations comes like, so no sometime as, so some people are like, is internally strong, but every person has a different ways to just cope with that situation.
Mm-hmm.
So this situation is already passed like 2 months ago, and it's not gonna be come back. And definitely I'm sure you don't want to be, that the person come back to your life who is already just, put you in this kind of situation. So just think about, like, like you're, because this is the life is not stopped at this point, right?
Mm-hmm.
You cannot, like, just like separate yourself to in, with all of the people, and you doesn't want to talk, because your son, your mother, and your friends and other family members on, they really want you to be, get better. They want to you be, you have like responsibilities,
Yeah.
especially for your son, like if you will, just if you think what have happened with you instead of your, son, so you're gonna be feeling more, bad for him, because his mother is not over there and the father is like that. So it's very hard for the kids. So, like, so it's
Yeah.
so better if you're gonna be see your responsibility towards your mom and your son.
Yeah,
So,
you're right.
and the life is never stopped,
Yeah.
I cannot say, like, you have to be a little bit move on for that,
Yeah, I got
yeah.
you
So
there.
you're good, you can get uh, probably in the good persons in, life, and you're
Mm-hmm.
pretty young, for all that stuff.
Yeah.
Yeah. Do you need any medications if you feel any anxiety, or, do you, I mean,
No, I don't. I don't know no medication, but like I'm just disturbed,
uh-huh.
because
Mm-hmm.
I never think that happened to me like that situation. So that's why I'm more disturbed. So that's like,
Yeah.
yeah, but I have no any medical issue.
Mm-hmm. Yeah, that's
Just
true.
only
Mm-hmm.
like I have a hard time to then I'm think about,
Mm-hmm.
then I don't know, just in my mind.
Mm-hmm.
So, but
So,
yeah, then I just
okay.
talk talk about like you guys talk to me, so like I feel better.
Mm-hmm. Good. Yeah. Mm-hmm.
That helped me.
Yeah, yeah. So as I give you the homework last week, right? So you have to get up and just tell yourself you're gonna be get better.
Mm-hmm.
So you told me like you feel something good.
Yeah.
So yeah, this time that's kind of, again, we're gonna be see again after 2 weeks
Okay.
again.
Yeah, that
And
helped.
then, yeah, and then your homework is this time is for, like, you're gonna get up in the morning and evening. I love my mom, I love my son, they are my responsibilities. Okay,
Okay. Yeah. Good.
so you're good with that, right?
Yeah.
Okay,
That.
yeah, because this gonna remind you what is your responsibilities and what is your importance. You're really important for your, the family you already have it.
Yeah, I understand.
Okay.
Okay.
Okay, do you have any questions for me this time?
No, thank you.
Okay, thank you for cooperating, and then we're gonna be see you within 2 weeks.
Okay.
Okay,
Thank
thank
you.
you.